So in our knees, we have a bunch of sacs that can fill with fluid that help lubricate our motions because the knee has a lot of range of motion and a lot of tendons that pass through there. So sometimes those sacs can expand and fill with too much fluid, and then the fluid gets retained there. And sometimes that's called a Baker's cyst. And occasionally it can be painful because our tendons are now a little bit more trapped because that space has expanded and it creates less ability to move rather than more ability to move. So a Baker's cyst might feel differently for different people, but it can present as stiffness in your knee, either with deep flexion or with trying to stretch your knee all the way out. It can feel like a dull pain that's in the same area and very persistent. Sometimes if you've been stationary for a long period of time and then you go to stretch your knee, it can start to feel like you have that pull back action. And that's because the knee hasn't been moving and the fluid has filled within there a little bit more. And then again, the tendons are responding to that extra swelling in the knee. So the good news is that physical therapy can help with Baker's cysts. So some of the things that you might do with your physical therapist to address Baker's cyst pain is manual therapy, working on the tissues. Your physical therapist will also watch you move and see if they can figure out, okay, why are we getting the swelling there? If you have lost range of motion, they'll help you with the range of motion. If you've lost strength, they'll help you regain the strength and improve your overall mechanics so that you don't get that irritation and buildup within the area of the cyst. And also they'll make sure that you're working with the correct team of providers to resolve your symptoms.